Good morning, everyone. I'm Bob Ravenscroft, Vice President for Advancement, here for our April 1st press briefing. I promise you no jokes here, though. Routine census at midnight, right short of 500. We had 477 patients. Currently, we have 17 COVID patients under our care. 7 of them are, longer stays where they're no longer infectious, but still hospitalized. And the one thing I would add about that is some of the members of the media were certainly here in November. I was rounding up there earlier this week, and it's very different. There are some doors, some of the glass doors that are still closed for isolation, but the rest of them are open, and the hallways aren't as congested. But, it's kind of this balance of hope and a dose of reality that personally witnessed 2 intubations on this at the same time up there. So people are still ill despite it getting better. I've got 2 things to really share here. One's kind of a general theme. Obviously, very wonderful news on the trials coming out on children's for the vaccine. As you've heard from physicians from Bryan and basically throughout the country, strong advocacy for everyone to get this vaccine, whatever version, as soon as they can. They are all safe. It is wonderful that they are opening up from a supply, and again, we could not endorse them any more strongly than we have. When you get a chance, do it. We do feel like we're in that race against time. It's kind of like in lane 1 you have variants, in lane 2 you have society wanting to get back to normal, and in lane 3 we have the vaccinations. And so please get your vaccination as soon as possible, and can just hang on a little bit longer with your non-pharmaceutical interventions and keep your family safe. The other thing I want to draw your attention to, specifically members of the media, and encourage them today to hop on a press conference that is being conducted by Nebraska Medicine in Omaha. It's a wonderful story of collaboration between Bryan and Nebraska Medicine, and one of the good news stories that has come out of COVID. So you'll learn more about this, but I know featured in this press conference is going to be Dr. Bill Johnson, who has been, frankly, one of our heroes in this whole effort for the past year. Certainly a pulmonologist takes him into the front lines, but he has been maybe one of the leading advocates in the city that got us practicing non-pharmaceutical interventions early on, and has helped Lincoln navigate this fairly well. But what this story is about is there was a young man that presented in November with COVID, and it kind of brings a lot of things we've talked together. This is a young guy that was in the hospital, ended up being ventilated, was at Bryan for months, over 2 months, and essentially everything began coming back to work except his lungs. He had to be fitted for, I think it's called a tracheostomy for, long-term permanent vent. And through Dr. Johnson's care, and when he was rounding on him later in the year, actually earlier this year in January, knew he wasn't going to get better because the lungs just wouldn't work without ventilation. And he fit a very narrow criteria for transplantation of his lungs, and was transferred to the med center. This press conference is going to be, about the wonderful outcome that this patient has had, that was a coordination of care between the med center and Bryan Health. Very meaningful for our staff. Again, they cared for this patient for well over 2 months, and it was wonderful to see that there were tears of joy versus tears of sadness for the team over at Bryan West that cared for this individual, this very young man with family for months and months and months. So I believe it's at 2:30 today. Brad has supplied local media contact information with the Med Center, so you should have been receiving that. But certainly hop on and let's see a wonderful, good story that came out of the very complex care that's delivered at Bryan and at Nebraska Medicine in the state of Nebraska. I'd say our tick up here has just been incremental, but it's not in other parts of the country where it's more rapidly. So it's something they're watching. A follow-up question came in about what concern is that to you? It is concerning. I think there's probably levels of anxiety from the clinical staff when they see it. And what is most concerning to us is some hesitancy around the vaccine. would be one, and it really goes back to we are in a horse race of getting people vaccinated before these variants take hold. So that's why we are strongly urging you to get them wherever, whenever, however you can now that it is opening up. Just rest assured they're watching it very closely. It's because of the variants is why you haven't seen us release or relax some of the precautionary measures around here. Of course, everything is universal masking in the hospital and will remain that way for some time, but even things like visitor restrictions, reinstating our valet service, all of the things that we used to do, that is difficult. That is difficult to unwind any of that as these variants are out there. Yes, variants are present in the state of Nebraska right now. I think it's the B117 that is most prevalent here, but we will also verify that one for KLIN.